I just wanted to follow up on that video. This video we wanted to do because yesterday we really did have a guy that was talking about his dad, and his dad's a radiologist, and he was saying, you know, that the problems with healthcare were so serious, and he's the one that brought up, once he learned about community currency, he was the one that brought up doctors. He said, my dad's a doctor, and guess how much he gets in, when he makes a claim for one of his scans, guess how much he gets for reading a scan. And we'd say 75% or 50% no, 40% no, 7%. He makes 7%, and normally, he says, what happens is the ladies in the office spend half the day arguing with the insurance companies about getting anything.
Yeah.
And I thought, you know, and apparently what they'll do is they'll say, okay, this is you owe us $100. You know, I read this scan or whatever, and the insurance company will say, we'll give you $20. And that's what he's saying. We'll give you $20. It's like, well, wait a minute. You know, this is crazy because this patient, in this case, these patients had insurance, and their insurance was not even taking care of the problem. And I feel that maybe we just need to make this simple. And I mean, I've talked to dentists that say they'd be more than happy to take half cash, half trade for dental. I've talked to eye doctors just the other day. They said they'd be more than happy to take half cash, half trade. They never see any cash patients.
So this is I guess we've seen now. This is probably a good opportunity for us to introduce unity currency. And once we was introducing it to them, they felt that after they really thought about it, they said, yeah, I think it could work. I think it could work with us.
Well, sometimes things get so complex, and we all know there's so much corruption that's beyond belief. And I think it's almost to the point you can't even point a finger anymore. We don't know who's getting the money. We don't know if it's the insurance companies or the equipment makers or the pharmaceutical companies or the lobbyists. We don't really know who's getting all the money.
But the patients is the one that's suffering.
The patients are suffering. And, you know, where this gets deep for me is elderly. The elderly now are in a position where they have their little nest egg, and we already know what's going to happen to that. And they're so terrified. And I'd like to have a way where they at least can take some of their money and know the game is the game. You know, they can see right now what they're charged. The charges are not based on what the insurance wants them to pay. What they get done to them is not based on what the insurance decides needs to be done to them. We can go back to a very simple equation. Here's my money, doctor. Do what you need to do to me, and I'll pay you what I can pay you, which right now half is pretty good. They'd be happy to get half, and I think many doctors would be more than happy to trade off their profit within the community. So that's why we did the Hillary video, and I hope you enjoyed it.